Kidney patients, how to take care of your health during summer. First of all, understand one important thing clearly. Summer is not just about heat. It is a season that directly affects your kidney function and body's fluid balance. During summer, excessive sweating occurs, which leads to loss of water and electrolytes from your body. And when the body becomes dehydrated, the blood flow reaching the kidneys decreases and the filtration process from the kidneys get affected, which means the kidneys are unable to remove toxins from your body. And this may lead to symptoms like fatigue, weakness, loose motions, vomiting due to high levels of creatinine and urea. That is why hydration and keeping balance of electrolytes is highly important. But simply drinking more water is not the solution. Maintaining the right fluid and electrolyte balance is very important. In kidney patients, if water intake is too low, toxins like urea, creatinine begins to accumulate, and if water intake becomes excessive, it may lead to swelling, increased blood pressure, and even fluid accumulation in the lungs. Now, let's talk about diet. During summer, people tend to consume more cold drinks, processed food, and outside food, which contains high amount of sodium, preservative, monosodium glutamate, citric acid, and various other acids, which directly put stress on the kidneys and it may hamper function of kidneys. For kidney patients, low salt diet or low sodium diet and controlled protein intake is very essential. Simple and easily digestible food is a necessity. The third and most important point is electrolytes. Through sweating in summer, sodium and potassium levels get decreased, and in kidney patients, the electrolyte imbalance becomes a serious condition. Symptoms such as muscle cramps, weakness, and changes in heartbeat should never be ignored. These are due to electrolyte imbalance. Kidney patients should limit their daily sodium or salt intake to 2 to 3 grams. Kidney dysfunction often leads to rise in potassium levels, which can lead to heart attacks and blood pressure increase. To limit potassium levels, patients should leach and boil leafy vegetables 2 to 3 times and cook the leafy vegetables in low oil. Patients should limit use of fruits also. Patients with kidney dysfunction with high potassium levels should avoid coconut water also. Kidney patients should avoid packaged and outside food. Another important concern in kidney patients is infection. In kidney disease, immunity is often weaker, and during summer, contaminated food and water easily leads to serious infections. Even a small infection can worsen the disease condition in kidney patients. And one of the biggest mistakes people make is stopping treatment as soon as they start feeling better. Kidney diseases are progressive in nature. They continue to develop slowly from within without the patient knowing it. That is why taking medicines on time and continuing treatment for a prescribed time is very important. At modern homeopathy, we have often observed that after starting treatment, within the first few months, patients begin to notice improvement in their health as well as in their reports. Their symptoms get reduced and they feel that they are completely cured. Patients stop their treatment on their own. But this is where the biggest mistake happens. If treatment is discontinued midway, the condition may worsen again. So, it is very important to start and stop their treatment under modern homeopathy's scientific guidelines. At modern homeopathy, treatment for kidney diseases does not focus only on symptoms, but also works on internal imbalance, filtration efficiency of kidneys, and disease progression. Modern homeopathic treatment completes all the criteria of kidney restoration, like increase in hemoglobin level, increase in RBCs, increase in WBCs or normalizing in WBCs, increase in platelets, reducing fluid imbalance. After modern homeopathy's unique treatment, kidney patients have not needed dialysis again. From past 25 years, our treatment is the only treatment that not only stops dialysis in end-stage renal disease, but also completes all the criteria of kidney cure. It cures pleural effusion, ascites, swelling on legs, swelling all over body, high levels of creatinine, high levels of urea, low hemoglobin becomes high, regularization in RBCs and WBCs, regularization in platelets, regularization in liver function tests also. Modern homeopathy's treatment method has been personally researched and developed by me, and it's a completely scientifically developed and proven treatment method. Over the last 30 years, modern homeopathy's treatment method successfully treated more than 2,15,000 serious patients. Our only goal is to give a disease-free and healthy life to all patients suffering from chronic diseases.